So you just mentioned everyone's worried about the risks of high cholesterol, but let's talk about what we need cholesterol for. There's a risk of having too low of cholesterol, correct?
Yeah, so that's a great question and a great point. So cholesterol itself is involved, as I mentioned, in immune function. It's also involved in cellular integrity and structure. It's also involved in the production of steroid hormones, and it's involved in the production of bile acids. And so all of these things are extremely important for bodily functions. So you want to make sure that you want to actually have cholesterol present. And so when we look at some of the drugs that just blanketly lower cholesterol production, like statins, we actually see increased risks of diabetes and possibly increased risks of cancer related to some of these components. I can talk about specific mechanisms if you like. And then we also see myalgia, which is driven largely by mitochondrial dysfunction inside the muscle tissue, because you can't produce certain proteins if you don't have some of the metabolites in the cholesterol production pathway that the statins block. And the next thing that we start to see with the statins is that you start to see issues with cognitive function over time in certain individuals. So we have increased risk of certain problems with statins, and we actually have direct quality of life problems with cognitive dysfunction and also muscle pain and muscle issues, myalgias, with statin use because of their effects on the cholesterol pathways, where in those pathways there's components that are needed for mitochondrial function, with the mitochondria being absolutely essential towards energy production, which for me is extremely important to focus on because I come from this perspective of energy metabolism, mitochondrial function being a central piece of health at large. So if you're blocking something that is leading to the production of certain proteins that optimize mitochondrial function, then what starts to happen is you start to see damage to the mitochondria, and you get these pretty significant symptoms like the myalgias, cognitive dysfunction, and an increased risk of diabetes and possibly cancer with statin uses over the long term. So these are things that came out of the clinical trials with statins later on, but like, oh, we're seeing this, this jump in diabetes risk. So those are things that we want to, you want to keep in mind when you're saying, am I going to hop on a statin? Am I not going to hop on a statin? And that's also why knowing your context is important in the first place, so that you can balance the pros versus cons of using something like that.
Hormonal imbalance is already crazy amongst people, men and women, estrogen dominance, all of this. So one more thing to screw up your hormones, right? I mean, that's only going to make things worse. You men are going to lose your testosterone and the problems in the bedroom, and women, that's not something anyone's really looking for right now.